constantly, we need to just always be innovative, thinking ahead, because no one could plan for a pandemic.
Over the past 2 seasons of Business Schooled, we visited companies across the country to hear their stories of growth and change. Now, as things change faster than ever, we're checking back in with them to see how these incredible entrepreneurs are adapting. I'm Soraya Darabi, and this is Business Schooled, Changing Course, a series by Synchrony. My guests today are Dr. Anastasia Gentles and Zawadi Bryant, owners of NightLight Pediatric Urgent Care, which has 8 locations across Houston, Texas. Working in the ER, Dr. Gentles saw how difficult it was for children to come to a hospital late at night. She knew it would be better for these families if they could just go to a doctor's office, even if after hours. So she recruited her friend Zawadi Bryant, an engineer and MBA, and together they created NightLight. It's been a while since, Business School connected with the two of you. What were things like at the beginning of the year, pre-pandemic?
So the beginning of the year is the middle of our flu season. So we were seeing a ton of kids. School had just come back in after the holidays, and we were seeing a lot of flu-like illness, which in retrospect was probably Corona and the flu.
I think the big thing was when people started canceling events, and the mayor started talking about closing schools and businesses. And I think that's when it started to get everyone's attention.
Yeah, when they cancel a rodeo in Texas, it's real.
That's huge.
Right, and then Texas is canceled. Well, I'm imagining that there was probably quite a lot of alarm among your patients and their parents. So what was it like communicating to your clients early on the information that you were receiving and processing in real time?
It was a little chaotic because we did not know what was going on.
The information was constantly changing. So just trying to be level-headed and not be fearful, but providing the facts as it was as of. So we started sending updates to our staff, and we would always have as of the date of the information because it was constantly changing.
What is work like now for you, and how has it changed?
Because there's so much information coming at the team, we have to kind of distill it and boil it down to like the critical information they need to know at the time. We quickly mobilized a team from our experience with Hurricane Harvey and realized as a management team, we had to meet on a daily basis in order for all of us to be together and on the same page. Documentation is important. Communication is important, and also just making sure that we are available to our staff.
And how does it change your communication, if at all?
So it's really, the starkest change is the whole social distancing. We're used to like high-fiving each other, hugging each other, and it's just so weird not to be able to touch somebody that you work with. And realize how much you did touch somebody when you work with them. We have done some Zoom meetings. We did one huge Zoom meeting with everybody, company-wide Zoom meeting, and we played some games with each other. So that's really helped, trying to do, connections over the internet, basically.
In terms of business and remote work, have you seen an uptick in telehealth? Or people requesting to talk to doctors on the phone?
Yeah, so thankfully, we are going on 2 years of doing telemedicine. So we already had that up and running. That just became a bigger piece of our business. And I would say in the last 3 months, we've probably seen more in the last 3 months than we've seen in the prior 18 months. And so it's grown a lot now out of necessity. So we've been waiting for this moment for people to realize how great telemedicine is.
And now that telemedicine has surged for you so much, what does this mean for your expansion plans?
When we look at growing and expanding, maybe physical locations, not so many of them are necessary. We've, expanded our reach through this whole pandemic, and, we're hoping just to expand that even further.
In the podcast in the past, we talked about how important it is for the two of you to have a practice that creates joy, that practicing medicine isn't just about practicing medicine, it's about creating the right culture.
How do we get that passion? What is that passion? How do we get it on paper, and how do we get it into other people? Part of that is hiring the right people, because if we're not hiring the right people, I mean, I can teach somebody to draw blood or, do the mechanics of medicine. I can't teach values. Like something about that has to be in the person that we hire. Yeah, we love our employees, and we are first and foremost about people. Like, we feel like nobody is put in our lives on accident. There's no coincidence.
You've talked about how you've looked out for your employees. Well, we thought we'd play you a little video.
Hi, Dr. G, and hi, Zawadi. It's Dr. Dow. I just want to say that I've been very proud of the way NightLight has handled the situation with the pandemic this year. We were able to pivot to telemedicine and not only provide patients quality care, but in a way that was safe for us and for them, and we continue to do so. I've really appreciated how we've been flexible with the scheduling and staying open when many other clinics did not. And the main thing is I'm so proud of our diversity and how we've been able to represent so many people and be solidified and unified during a time where many people are not. And so for that, I thank you, and I cannot see myself working for any other company during these turbulent times. I'm very proud of y'all and all you've done. Thank you.
Oh, you trying to make us cry?
I mean, there's so many compliments packed into one short video.
Dr. Dow is one of our physicians, and she works at all of our locations. And so she comes up with all these different creative ways to actually keep the touch going, like you were saying, during these low-touch times, and to appreciate our employees and promote our business from a value standpoint. So she's amazing.
Zawadi and Dr. Gentles, what lessons can be gleaned from the past 6 months as you prepare to expand your business even further?
We need to just always be innovative, thinking ahead, because no one could plan for a pandemic. No one can plan for a pandemic, but because we were already doing telemedicine, we were prepared. So now we're thinking, okay, like what's the next two steps ahead? And so I think that's the big lesson for us is constantly don't be content with where you are. Like always, be innovative, always think ahead, because you need to be prepared to shift if necessary.
I invest in healthcare businesses for a living, and I think what the two of you are doing is absolutely right. And just as Zawadi said, no one can plan for a pandemic, so that's off the table. But having a plan B, C, and D in your back pocket in case of an unfortunate event is really crucial. So thank you very much for sharing your story.
Thank you for having us.
Thank you for having us. It's been great.
Keep watching to see how other business owners like Zawadi and Dr. Gentles adapted their businesses.